Welcome to the Explainer. Packing your hospital bag seems like just another thing on the to-do list, right? But what if I told you it's one of the most critical steps you can take for a safer delivery? Today, we're turning all that medical advice into a simple, actionable guide. Let's get to it.
And this quote from Dr. Prashanth really hits it home. This isn't just about making sure you have your favorite PJs. We're talking about a serious, evidence-based medical step. Think of it this way. What's in that bag directly impacts things like infection control, your own recovery, and your baby's safety. It's a huge deal.
Okay, so why all the fuss? Why is this bag so important from a medical standpoint? Well, it all boils down to this incredible hormonal battle that's happening inside your body during labor. And believe it or not, being prepared can literally tip the scales in your favor.
Check this out. This is the science behind it all. On one side, you've got oxytocin. That's your best friend during labor. It's the hormone that keeps things moving along. But on the other side, you've got adrenaline, the stress hormone. And here's the kicker. When you get stressed, say because you can't find your toothbrush, your body releases adrenaline, and it actively blocks the oxytocin. It's like putting the brakes on your labor. That's why a packed bag isn't a luxury. It's your secret weapon against stress.
All right, let's shift gears and talk about the physical reality right after birth. Because that bag you packed, it's not just for one person. It's designed to handle two huge simultaneous physiological shocks.
And this table lays it all out so clearly. For you, the mother, your body is going through a lot. You've got heavy bleeding starting, your hormones are on a roller coaster as milk production kicks in, and your breasts are becoming super sensitive. Meanwhile, your newborn is experiencing its own massive shock. I mean, think about it. They've just gone from a cozy 37 degrees Celsius womb to a 22-degree hospital room. That's huge. And their skin is like a little sponge, losing heat like crazy. So every single thing in that bag is there to tackle these two big challenges.
So, now that we understand the why, let's get to the what. This is your doctor-approved action plan. And I want to be clear, this isn't just a friendly list of tips. This is a set of clinical directives, the exact gear you need to pack to face these challenges.
And here is the first and maybe most important rule. Week 34. That's your deadline. By week 34 of your pregnancy, this bag needs to be packed, zipped, and sitting by the door. No exceptions. This isn't just a nice idea, it's a medical directive. Why? To take all that last-minute panic completely out of the picture. Okay, let's break down what goes in the mother's bag. And look, everything on this list has a specific medical job. We're not talking about regular pads. You absolutely need high-absorbency maternity pads. And the high-waisted panties? That's a huge one, especially if you have a C-section. They're designed to sit way above the incision, which helps prevent painful rubbing and infection. Oh, and see that word unscented? That's a big deal. We'll talk more about why in a bit.
Here's a fantastic little pro tip that's actually a medical rule of thumb. It's called the two-finger rule for your nursing bras. You need to be able to fit 2 fingers comfortably under the band. Why? Because a bra that's too tight can block your milk ducts. And trust me, that can lead to a really painful infection called mastitis. This simple check can save you a world of hurt.
Okay, on to the baby. The #1 priority is keeping their body temperature stable. And you don't have to guess how to do it. Doctors have a super simple rule for this, the 1+1 layering rule. Just dress your baby in one more layer than what you'd need to feel comfortable in the same room. So if you're fine in a shirt, baby needs a shirt plus a swaddle or a light blanket. See? Easy.
Now, looking at the baby's checklist, there are a couple of really specific things to call out. First, all their clothes must be pre-washed. You've got to get those factory chemicals off before they touch that super sensitive absorbent skin. And here's a surprising one. No hand mittens. I know, it feels like the right thing to do, but a baby's hands are how they explore the world. Covering them up actually cuts off important sensory information that their little brain needs to develop.
Let's not forget the support person. Whoever is with you, your partner, your mom, they're part of the team, and they need to stay energized. This is their 24-hour survival kit. Pack high-protein snacks to avoid those sugar crashes from tea and biscuits. Bring warm clothes because hospital AC is no joke. And maybe the most important job, they become the information officer, handling all the phone calls so you, the new mom, can get the rest you desperately need.
Okay, this is a super important point, especially for our viewers in India. Your hospital bag isn't a one-size-fits-all thing. Depending on whether you're going to a private or a government hospital, about 40% of what you pack is going to change. Let's dig into that.
So it all comes down to strategy. If you're at a private hospital, your main job is to find out what they already give you. Ask them for their maternity kit list ahead of time so you don't pack stuff you don't need.
Now, if you're at a government hospital, the game changes. Your strategy is all about being self-sufficient. That means packing your own hygiene armor, things like toilet seat sanitizer and extra soap, and even bringing your own large water dispenser so you can stay hydrated without having to leave your bed.
All right, let's talk about something really, really important. We need to tackle some common myths. These are things you might hear from well-meaning relatives, but they are based on misinformation and can be incredibly dangerous. We're going to use hard science to bust them.
Okay, myth number 1, using old saris for bleeding. Let me be absolutely clear here. This is not a safe traditional practice. It's a direct invitation for dangerous bacteria to enter your uterus, which can cause a potentially fatal infection called puerperal sepsis. The only safe option is a sterile, medical-grade maternity pad. No exceptions.
Myth number 2, giving a newborn honey or sugar water. This is another huge one. Please listen closely. Giving a newborn anything besides their mother's colostrum is dangerous. Honey, in particular, can contain spores of bacteria that cause infant botulism, which can be fatal for a baby. The only thing your baby needs as their first food is your colostrum. That's it. Full stop.
And myth number 3, don't drink too much water or you'll swell up. This is just scientifically wrong. Look at the fact. Your breast milk is 87% water. If you get dehydrated, you're not going to stop swelling. You're going to stop producing milk. Plus, you'll get severely constipated. You need to be drinking 3 to 4 liters of water a day. It's not optional.
Okay, you've done it. The bag is packed, it's sitting there ready to go, so now what? We've reached the final piece of the puzzle. What are the actual signs that mean it's time to grab that bag and head to the hospital?
So when do you actually leave? The goal here is to get rid of all the guesswork and the is this it panic. You need to be looking for clear, objective signs. These aren't just feelings. They're real, measurable events that are your body's way of saying, okay, it's go time.
And these are the signs. You really need to pay attention here. If your water breaks, whether it's a big gush or a slow trickle, it's time. But here is the critical, non-negotiable part. Look at the color of the fluid. If it is greenish or brownish, that is an emergency sign of fetal distress. You need to get to the ER immediately. Same goes for those preeclampsia red flags, a blinding headache, blurry vision, or sudden swelling in your face and hands. Don't wait, don't call your aunt, just go.
And really, that's what this is all about. This quote brings it all together. Having that bag packed and ready isn't just a chore you cross off a list. It's a psychological anchor. It lets your brain switch from anxious preparation mode to calm readiness mode. It's the final step that lets you walk into that hospital feeling empowered, in control, and ready for one of the most amazing moments of your life.